Okay, so good evening, Dr. Saini. Thank you for joining me today and allowing me to interview you and ask you a few questions regarding what you do. So to start off, would you like to introduce yourself?
Hello, yeah, I'm Sunita Saini. I'm a board certified pediatrician and the chief of pediatrics for the Health Services Agency of Stanislaus County. And I'm a pediatrician for Scenic Faculty Medical Group, and I'm also one of the clinical professors, teachers for the residency, the family medicine residency called VCME. So.
Okay, thank you. And now just to kind of start off and flow into the introductions about your career and your background, what inspired you to become a pediatrician?
Sure, yeah. Well, my parents lost my sister when she was a baby in India, and that definitely motivated me to make sure that doesn't happen to another family again. If I could prevent it, is what I always thought when I was a kid. And then when I volunteered as a hospital volunteer and I saw children so sick in the pediatric unit, it broke my heart, and I knew that is something I wanted to make sure children didn't have to suffer through.
Yeah, I think that's very inspiring, and thank you for sharing that. So what does a typical day as a pediatrician look like for you?
Yeah. I'll say in general instead of for me, because I wear a lot of different hats, and so I have a very different schedule. But in general, when you graduate from pediatric residency, you do a combination of inpatient and outpatient work. So when a baby's born, you round on them in the newborn nursery. Then you do your outpatient clinics, which consists of both sick children and well children for their vaccines and well-care visits. And then if a child in your practice gets really sick, then you have to admit them to the hospital and then round on them as well. And then, of course, there's night call, which is for the families and parents who don't know what to do when their child is sick in the middle of the night and call for guidance.
Yeah, okay. And what would you say that what are some misconceptions that people typically have about pediatricians or about pediatric medicine?
Oh, I think the number one myth is that children are small adults. So children's physiology is so different than an adult. So you can't just tell them, here's a pill, cut it in half and give it. No, like the medicine dosing is based on weight, for example. And even the blood pressure is based on height and age, and not just 120 over 80 is a normal blood pressure. So I think the biggest myth is that they'll be fine. Well, no, there's a lot of different physiology that's why pediatrics is a specialty.
Yeah, I think that's important for a lot of parents specifically to hear, especially those that may not have access to this kind of education. Um, and now going a little bit into youth health and daily habits, what are some of the biggest health challenges that children and teenagers face today that adults often overlook?
Sure. Obviously, I believe that the top three in the country right now would be pediatric obesity, with the complete lack of nutritional guidance for children. It would be mental health, of course, especially since the pandemic, thinking that kids are okay and they're not. And the third would be probably the social media and the electronic devices, and the lack of being outside and outdoors, which impacts you in every way, physical and mental.
Yeah, and are there any specific unhealthy trends among teenagers that's concerning you the most right now, personally?
Sure, the Starbucks Dutch Bros, the insane amount of sugar is like just an after-school daily necessity and trend, which not only has the sugar impact and the caloric excess, but the caffeine impact, and then they don't hydrate. So that would be a huge one. Vaping would be another absolutely huge thing going on, and children think that it's just a flavor, but it obviously is not just a flavor. It impacts all of your multiple body systems. It could also be laced with things such as fentanyl, and then you die. So those would be the top, some of the current ones. Mm-hmm.
Yeah, and would you say that schools have done a good job spreading awareness about these issues that children and teenagers obviously are vulnerable to?
I'm sure that they try, but kids don't really respond well to a lecture or to a pamphlet. It is going to be engaging youth to youth, their own age group teaching, a beautiful family conversation, not a lecture or where it's more engaging with real life examples. A teenager who maybe experienced a negative effect of that, coming in and saying, "This was my experience," and they say, "Oh, bro, I can't believe that happened to you," as opposed to a 50-year-old teacher or parent saying, "Don't do drugs," right? So it's a little bit of a different way, but the schools are doing their best. I'm very appreciative of everything that they're trying to do. Maybe something like that, kid to peer might have a little bit more of an effect.
Yeah, and would you say that there are specific health habits that young people should start building now to stay healthier later in life?
So great question. The number one thing would be nutritional and movement. We don't even say exercise anymore. We say the word movement. Nutrition and movement care. So consistent fruits, vegetables, lean protein on a daily basis. The sugars, the fried foods would be a once every 1 to 2 week tiny amount treat. You can't have a full true restriction because a child would backfire, right? And movement, meaning instead of indoor video games and even the schoolwork, endless schoolwork, just to have 30 to 45 minutes of a screen for homework and then taking a break. And that break could be a movement break where you jump or maybe dance in your room or take a walk outside if it's safe for you to do so. So yeah, nutrition and movement would be the two big ones.
Yeah, and I like that you brought those terms up, nutrition, movement, exercise, etc. So how would you say that those aspects of health impact students' academic performance and mental health?
Yeah, sure. Because if you have a sugar spike, you'll have a sugar crash, for example. And then unhealthy foods can lead to many, many things: fatigue, headache, and then without the lack of movement, again, no energy to do your work, not being able to maintain focus, memory issues. So it's pretty impactful and pretty necessary to do. Yeah.
Yeah, and earlier you mentioned social media. So would you say social media positively or negatively affects youth health?
That is a great question, too. During the pandemic, social media is all children had because they were not allowed to interact with their peers. And so that without social media, I wonder how much more mental health problems we would have had. So there are certainly occasions where social media could be helpful, but the problem is the excess use of that is having an absolutely devastating effect, and the bullying that occurs on there, the need for recognition, the fake profiles, meaning the fake life that the dual life, the life that you have and the life that you claim to have, and so that could cause a lot of confusion in a child, and the goals are different. So social media in general needs to be parent monitored, of course, and secure and safe for the child. So that is purely a benefit as opposed to all the negatives.
Yeah, and going a little bit into emotional wellness, what role does mental health play in pediatric care today compared to the past?
Great. Yeah, I don't know about how many screening tests we had in the past, but now we have so many. We have the SCARED exam for children for anxiety. We have the PHQ and GAD, which are the mental health, depression, anxiety screens for teenagers. It's incorporated into our every single well care, which is a huge advancement, huge improvement. And then, of course, licensed clinical social workers that stay within our clinic system so that we can refer immediately if we notice a red flag or a problem. So I do believe that pediatrics has done a great job making sure that mental health is part of our daily care for our children.
Yeah, and are there any specific signs that parents and teenagers should look out for when a young person may be struggling mentally and emotionally?
Yeah, Yes. Doctors look for these signs. We tell the parents look for the signs of disengaging from family and friends, staying in their room, oversleeping, overeating, undersleeping, undereating, basically what they were before, and then a complete change. Starts off subtle, but then it goes even all the way to the extreme of if there is a drug use, for example, then finding money missing in a wallet, or things like that. Yeah, there's many different signs, but for mental health, just I love to trust the parental instinct that he or she is not the same. There's something different, and so listening to that cue from the parent, and then diving deep alone with the teenager, because they do feel shy talking or scared to talk in front of the parents. So having a personal conversation with them with what's going on.
Yeah, I think that's very important for a lot of the teenagers and the youth nowadays to hear. And I know it's very emphasized nowadays too, so I think that's very important, especially for our generation. And in terms of access to care, going a little bit into health equity, what are some barriers that families face when trying to access pediatric care or preventative services?
Yeah, I mean, in this population, in this area of California, that is a concern and an issue. So if you're in a big city, an urban setting, you're more likely to have more specialty care pediatrics. In the Central Valley, not only are we short the primary care pediatrics, but we are definitely short the specialty care. So if I have a child, for example, that needs a neurologist, a brain doctor, they can't go across the street. Right? They might have to be referred an hour away to San Francisco, Oakland, Palo Alto, Sacramento, for that care, and then that wait could be 8 months to a year. We're so appreciative of all of the specialists that we have available to us, such as neurology, endocrinology, cardiology, but they are really over impacted because there's so few in our area. So it is kind of hard for children here to access. They have to drive other places too.
Yeah, and how would you say that a child's environment or community affects their long-term health outcomes?
Yeah, if you don't have a community or environment that is pro-children and don't have the financial resources for their outreach programs, and they're not going to be as successful. So we do need schools and cities to, for example, the first thing I said was about nutrition. So we need to have the unified school districts have nutritious lunches, and ensuring that children have meals when they go home, before school, the free breakfast, which I love that our school district does. So yeah, the whole community has to raise these children. It takes a village.
Yeah, and going back to you specifically in your job, how do pediatricians work to make sure every child feels seen and understood regardless of their background?
Sure. Well, yeah, right. So obviously, in the field of medicine, we have a Hippocratic oath that we will do no harm, and we will also treat everybody fairly and equitably, not taking anything into consideration of race or income or educational background, of course, unless it is relevant. So health equity, the word equity as opposed to equality, is not that all patients are treated equal, because, for example, someone in a wheelchair cannot be treated equally. They need extra resources, right? So making it equitable for that person and giving them extra resources. So we do look at each patient to see what can we do to make things equitable for you. If your parent works 2 jobs and you're unable to come from 8 to 5, how can we then serve that patient? Well, we can have after hours care. We can create a telephone appointment so they can have a 3-way call and not have to leave their job. So that's what some of the things that we can do to help.
Yeah, and within the same category of health equity, how would you say teenagers can advocate for better health resources in their schools or communities?
Sure, you guys are the generation that'll make it happen. So, talking to friends in your school, seeing what things they are lacking, creating a group, a club, let's say a nutrition club or a wellness club, going to your principal, going to the unified school district and saying, hey, we noticed that you're giving us chicken nuggets and pizza Monday through Friday for lunch, and our doctor said not to do that, so what are we supposed to eat? And creating dialogue and discussion and advocating for yourselves.
Yeah, I think that's important for a lot of the teenagers to hear. In terms of them being able to use their voices, I think more people should speak up about this idea, because I think a lot of teenagers are capable of doing it nowadays, especially with all the resources that we have. And yeah, pretty much to close off, what advice would you give teenagers who want to pursue careers in medicine or public health?
Oh, great. Definitely when you go to college, connecting with a pre-med advisor, getting your 4-year plan, and getting all of your experiences that you need to get, because it's not just grades, it's volunteering and patient care, and and you were talking about public health. You don't always have to go straight to medical school. You can get a master's in public health. That would be amazing first, and then understanding the nuances of health care systems, and then becoming a nurse, physician, dentist, anything, optometrist, and understanding how the background of it all.
Yeah, and finally, if you could change one thing about youth healthcare in America today, what would it be and why?
I could change one thing about youth healthcare in America. It would be more funding for our government. Our government understanding that the children are our future. Without them, we will stop existing. So we need to make children the healthiest they can be and give them endless resources for their mental health and physical health.
Yeah, okay, and that pretty much wraps up the discussion. So thank you for all the insight and information that you shared. I think it's very impactful, and your story is very inspiring, and thank you for everything that you do, and thank you for sharing all this information. I think it's very important for a lot of the teenagers nowadays to hear, and yeah, thank you.
You're very welcome.